In this video, we are going to review what diastasis recti is, what the research and literature actually supports so we can stop buying into the fearmonger, and how to start healing your core today and into postpartum and beyond. Let's dive in. Hi there, I'm Dr. Jessica London, doctor of physical therapist, pregnancy, postpartum, and strength specialist, mom to two, and owner and founder of Your Postpartum PT and Wellness. This is exactly where we help moms heal their pelvic floor and core 100% virtually, whether that's in a self-led option or a private one-on-one support. We can help you whether you're 2 weeks or even 10 years postpartum, so this is definitely the space for you. Make sure you subscribe and even hit the thumbs up so that you can get our weekly free videos and we can reach more women and moms with this high-value free content. So let's start with what is diastasis recti. Diastasis recti is the thinning, widening, and weakening at the linea alba, as you can see in this image here. You can see that diastasis recti can happen above the umbilicus, at the umbilicus, and below the umbilicus. So there's different forms and different functions that diastasis can occur. Now, diastasis recti is physiologically normal in pregnancy and in postpartum. And even children and men can have diastasis recti too. So it's not something that we need to fearmonger about not wanting to get diastasis and fearing that our abs are going to be destroyed and split. At the end of pregnancy, nearly 100% of women will have some form of diastasis. So it's not as much about preventing diastasis or trying to keep away from getting diastasis. Instead, we should be asking the question and empowering pregnant women, how do I maintain as much tensile strength and core strength throughout pregnancy to reduce the amount of dysfunction that can happen at the core? I like to lead with a message more of empowerment that we can start supporting women in the pregnancy and in postpartum phases to heal their abdomen and to work on strengthening and good functional coordination and movement and connection that will help diastasis because it's sort of natural to happen regardless. Even studies show that at 6 weeks postpartum, about 50% of the population of moms will still have some lingering diastasis concern. And then at 1 year, 12 months postpartum, about 1/3 of mothers, about 33% of moms will still report some persistent diastasis concerns. So I think it's really important to address that it's not something that we're going to completely avoid and that there's safe and unsafe, but rather how do we progressively strengthen our abdomen throughout pregnancy to maintain as much tensile strength, and then how do we start core rehab after having a baby safely and appropriately over time, progressively over time, so that we can start working on rebuilding the core and the abdomen. It's also really important to note that just because somebody has diastasis recti doesn't automatically mean that they're going to be dealing with back pain or leakage or prolapse or other core issues. There's a lot of research that also shows that people who have diastasis, it's a functional diastasis, meaning they don't have any of those symptoms and they don't report any injuries. While somebody else could have a quote-unquote fully healed diastasis where it's under the minimum requirements of width and depth, but they do really struggle still with leakage and heaviness and pain. So I think I want to break up with the idea that just having diastasis alone is going to contribute to all of the other pelvic floor and core conditions that you might be hearing. That could be true, and it also could not be true. So the gap alone isn't a predictor of how you're going to function with your diastasis. What's more important is how you transfer load and pressure when you cough and sneeze and exercise. Do you have the tensile strength? Do you have the coordination in your abdominal wall to be able to manage that pressure that is being transferred through the core canister system? That is a more important question. But let's dive into what is abnormal and considered within normal ranges. Anything greater in width than 2 centimeters is considered more abnormal, where we would really want to spend some focused time and attention on rebuilding. Maybe you're working with a pelvic floor therapist or a real good specialist in postpartum rehab on your diastasis specifically. So there's a lot of different ways that you can measure the diastasis, and it's also important to note that they're not all exactly comparable. Some of the studies are looking at it from an ultrasound, and others are doing more finger palpation. And all of these can be a bit off, right? We don't all have the same finger size. So if we're measuring on finger width alone, then it could be leading us to a false direction. What's most important is that we're using a baseline. So with that, we can show you a self-assessment, or I'll lead you to a way where you can check out a self-assessment for your diastasis at home, but also just understand that there is some abnormality to this, and it could be plus or minus. When we're looking at diastasis, we're also looking at the depth of the diastasis. So we want to understand, how do your deeper core system manage the tension under load? So there's width, right? How wide is the diastasis? But there's also a better intake that it gives us on how much tension you have below or behind that original thinning, widening, and weakening that's occurring. When we ask you to activate, and when you activate your core, do you notice that it's a bouncy end feel? Does it push? Do you have resistance when you insert your fingers between it and you lift up your head, or you do a certain movement pattern? Or are you noticing it's feeling kind of hollow and there really isn't much tension behind to be able to reverse? That's also a good indicator of how much deeper core strengthening that you have, where you're able to manage the pressure and load transfer of diastasis recti. And lastly, it's important to remember to be patient with yourself as you are healing your diastasis and as you are healing your abdomen postpartum. The linea alba is made up of connective tissue, and connective tissue can take quite a while to heal. So don't expect results in just 4 weeks, or going to a couple sessions, or trying an exercise program for a couple weeks and expecting major results. This is something that you really need to consistently stick to for 3 to 6 months to see actual tissue measurable changes in your abdomen, whether it's aesthetic or whether it's closing, whether it's more of the test and a retest of the assessment that you're doing at home. Make sure that you're giving yourself enough time and don't fall victim to 4-week bounce back programs. So if you're looking for next steps to start healing and addressing your diastasis, or maybe even test to see if you have one yourself, you have 2 options that you can follow right now to get started in your healing. Number 1, you can join our Pelvic Floor and Core Collective. It is a accessible, low-cost membership where you're able to join for the first 7 days for free, get your diastasis video self-check, and a complete pelvic floor and core rebuild program so you can start working on your abdomen and your pelvic floor today. This is 100% self-led, or we have a second option where you can work with us one-on-one privately, led by pelvic floor therapists over video calls and private access, and we can create a customized program for you 100% virtually so you don't have to leave your home or schedule childcare. Looking forward to seeing you in the next video.